Canada's spending on pharmaceuticals has skyrocketed in the past 2 decades. This country is only behind the U.S. in per capita spending on drugs, and provinces and doctors are calling for a national solution. A poll just this summer showed as many as 91% of Canadians want some kind of universal drug plan. So what can the next government do to try and curb the climbing costs of drugs? And should Canada have a universal pharmacare program? Joining me now from Vancouver is BC Liberal candidate Hedy Fry. In Edmonton, Alberta, Conservative candidate Rona Ambrose, who also happens to be the Health Minister. And Winnipeg tonight, Manitoba NDP candidate Erin Selby. Good to see you all, ladies. Appreciate you being here.
Thanks for having us.
So an important topic that a lot of Canadians talk about around the dinner table and care about. Let me start with you, Erin Selby. The NDP has long called for a national pharmacare program. This time you are not committing to universal coverage. Are you ditching that pledge, or where is it going?
Absolutely not. We're committing to a universal drug plan for all the provinces. You know, I can tell you, Rosemary, it's not just the NDP that have been calling for this. Ministers across this country have been asking for a universal drug plan. I've sat at ministers' meetings just last year. Minister Ambrose was at it, and the rest of us were all around the table from every party saying we needed a national universal drug plan, and that's what we're going to do. One of the main things we'll be able to do is group buys, because as you can see, when you're only buying one province at a time, you can't negotiate as a good price, but we'll be able to do bulk purchasing, and that's going to automatically drive the prices down.
Okay, but you're not doing that in the first year. You're not even doing that in the first 4 years, is my understanding.
Absolutely. We're bringing in an ambitious but a realistic plan that is going to have two parts to it. One part, we're going to be able to do bulk purchases, because I can tell you here in Manitoba, as a former health minister, we were purchasing for about 1 million people. Well, you can imagine when we can get all the provinces and territories, federal government, all the provincial governments together, we can purchase for 34 million Canadians, and that's going to be a lot more powerful. But we're also putting money in, $2.6 billion over the next 4 years, towards making costs cheaper for families, so that provinces can put that money into where they need to bring costs down, if it's a pharmaceutical program, pharmacare program. But right now we know the Canadians are paying 62% more out of pocket for pharmaceuticals, for their prescription drugs under Stephen Harper than when he came into office.
Just to be clear, though, a national pharmacare program under an NDP government would be in place after 4 years? Is that the rundown, the timeline there?
What I'm telling you is that we're working towards it with the provinces. We're not going to sit down and do this unilaterally.
Okay.
That's the Conservative way. We're going to be working with the provinces towards a universal drug plan, but beginning with bulk purchasing, we can see savings up to 30% for doing that.
Okay, but no answer on the timeline, just to be clear.
The timeline is the $2.6 billion over the next 4 years, working with the provinces, and I can tell you, as a former minister, we've all been asking for this.
Okay, still, I just point out, no clear timeline there for me. Rona Ambrose, I know you have said many times that Canadians are being ripped off too when it comes to the cost of prescription drugs. What specifically have the Conservatives done? What more is there to do to tackle high costs?
Yeah. And Erin's right about that. So Canadians pay more for prescription drugs than I actually think they pay more than the Americans do, Rosie. And that's because the provinces for years have negotiated separately and privately and behind closed doors for their drug plans. So I talked to the Minister of Health in BC. He doesn't know what the Minister of Manitoba paid or what the Minister of Ontario paid. And what the pharma companies do is they play the provinces off each other. So the Council of the Federation, which is the premiers and the provinces, have come together in the last few years, and they're starting to bulk purchase. And just with, I think it's only 11 drugs that they're working together on, they've saved $250 million in the costs of buying drugs for the provinces. So I approached them actually 18 months ago, and I was really thrilled that in July, the Council of the Federation, the premiers, granted the federal government the opportunity to come to the table. So we're at the table now with the provinces to start the bulk purchasing process. And why that's important is the federal government buys as much drugs as Manitoba does, but more importantly, we already do bulk purchasing for the provinces on things like vaccines. So we've been able to save a lot of money for the provinces on things like vaccines. We've got a lot of expertise at Health Canada and at the federal level for these kinds of large negotiations. So if we work together, we can gang up and on the pharma companies. But actually, most importantly, it has to be transparency. If they can play each province off each other, we're never going to get a good deal. And a pharmacare plan that just covers more is like an open bar for pharmaceutical
okay,
companies.
But I guess the point that some people would make there too, though, Ron Ambrose, is the federal government waited for the provinces to do something here. They didn't take any leadership of their own to do the bulk buying, which is what you've suggested. And why did it take you so long to decide that you wanted to get involved in this if you only started it 18 months ago? How important is it for the Conservatives, given that?
It's very important, and I'll tell you, it was, I think, election 2004 in our platform years ago where we wanted to work with the provinces on a national pharmacare program, and we weren't able to get agreement from all the provinces. I really think that we as a federation have come a long way on this issue. Provinces are now working together because the costs of drugs have gone up exponentially. It's a large part of every province's healthcare budget.
Rosemary,
we've been offering to come.
The provinces have been asking for this for 10 years. We've been asking it from the Liberal government before, and we've been asking for the Conservative government to come to the table. I was sitting at the table a year ago with Minister Ambrose and the ministers across the country, and we were asking for a universal drug plan. Why didn't she deliver it then?
I need to hear. I'll let Ms. Ambrose respond, but I need to hear from Hedy Fry there.
You know, this is ludicrous. I mean, in 2004, there was an agreement signed with Paul Martin and all of the premiers. That was a time when actually the Prime Minister met with premiers, and they agreed on a pharmaceutical strategy. The money was put in. It was ready to go. This government came in, and they cancelled, walked away from the table, didn't do anything. So it's kind of rich to hear Ms. Ambrose saying that they suddenly decided that they would do something about it.
I know, but Ms. Fry, to be fair, the Liberal Party as well, under previous Liberal governments, have been under pressure to do the same thing and didn't do it either.
But because we, as Ms. Ambrose says, we couldn't do it without the provinces. The provinces came to the table in 2004 and signed an agreement, and we put the money in. $41.2 billion was put in by Paul Martin to deal with a lot of the structural changes, including pharmacare, that we needed. But the problem here is I listened to the NDP, who were going to balance their budget in 6 months, and that's why they're reneging on all of the things that they said that they would do, including a pharmaceutical strategy. We now have to wait 4 years.
Okay, and I'll let everybody respond.
Is the most contagious disease. And if we don't do something about it now, tuberculosis is spread by droplet infection. It means I can be standing on the street corner, somebody with TB can cough, and I will get it. This is an urgent issue.
Okay, but does the Liberal Party support a national pharmacare, a universal pharmacare program? Is that what you're proposing?
In his letter to the premiers, you saw that healthcare was one of the 3 issues that Justin Trudeau will put on the table immediately, and included in that is a pharmaceutical strategy. And we know the urgency of a pharmaceutical strategy.
But what does that mean? What does that mean, Ms. Fry?
Well, what it means is that it is something we're committed to. Now, I can't give you the details because we're going to be rolling out our healthcare program in great detail later on. But I am telling you, it is a commitment. You saw it in a letter written by Justin Trudeau to the premiers.
Okay, we've only got 3.5 weeks left. Just putting that out there.
Rosemary, the Liberals had 12 years to get it done. The Liberals had 12 years in government to get it done. They didn't get it done. The Conservatives have no interest in getting it done. We sat around the table a year ago and discussed this with Minister Ambrose sitting right beside me as we were talking about this.
And Aaron, it took 18 months for the premiers to agree to it.
Ladies, no one can hear you. Aaron Selby, finish off, and then Ronna, you can go.
Panic button.
Okay, Ronna Ambrose.
Sure. We did discuss it around the table, and it was an urgent issue for every health minister, and it's something that's important to all of us. Every one of us has family that struggles with prescription drug costs, but it did take that long for it to get to the Council of the Federation, to the Premier's table, because they had to give permission for us to come to the table as the federal government. We have that permission now. We're starting to work with the provinces. It's going to take some time, but the bottom line is we've got to work together. Otherwise, the pharma companies will continue to divide and conquer. It is true, Hedy. It happened in July at the Council of the Federation meeting.
In 2004, the premiers were at the table wanting that to be an agenda item. And in 2006, you guys decided that you were going to have nothing to do with the provinces. You didn't want to talk to the premiers. And you reneged on that promise to deal with pharmacare that Paul Martin signed with the premiers. So this is sort of a nice little piece of history that's rewritten right now by you, Ms. Ambrose.
Well, I'm glad to now be at the table with the premiers and have their invitation to sit with them And
Took so
now
long.
we can actually work together, and it's the only way we're going
we
to
have been working
deal
together.
with
They
these.
asked
We
you
have
to
been
come to
working
the
together in
table
a
a long time
vacuum
ago.
without the federal government, and that's why the
We said
provinces
no.
came together
Okay.
to make a pan-alliance, and we have found some savings with that. But we did that at the absence of the federal government. What we
Yes.
need to do is
Okay.
have the federal government, the territories, and the provinces come together, and that's what the NDP is going to do.
Okay, ladies, I'm
And
going to
that's
leave it
what
there.
we've been doing.
I'm going to leave it there. Thank you. As you
Wow.
all know,
Thanks,
an
Rosie.
important conversation that a lot of Canadians care about. So thanks for getting your positions out there.